What is the first sign of civilization? It wasn't the wheel, nor was it fire, nor was it writing. Some will say that the answer lies in a bone, a human femur found in an archaeological site thousands of years ago, and it had an extraordinary feature. It had been broken, and yet it had knitted itself back together. This knitted bone is the first sign of civilization, because civilization does not begin with a tool, rather with an extended hand. And it is exactly there where we also see global health begin, in the awareness that each and every one of us, before or afterwards, are a broken femur, in the conviction that taking care of those who cannot take care of themselves is not an act of charity, but rather the very essence of what makes us human. No society, therefore, deserves to call itself civilized if it abandons those who fall. For this reason, and when I stand before those who are using national priorities to exclude, many others of us understand for some time now that the true priority of any state or country is to protect the health of its own citizens without exceptions nor conditions. Because anyone who divides societies between first and second class citizens are not strengthening their countries, but rather weakening them. Leaders who are coming to these institutions to divert millions of public funds to private corporations and weakening the common good to enrich a few. Whoever converts health into a privilege and subject it to the dictates of money break the most basic social contract of any democratic system. The consequences of this model are simply devastating. 1 in 4 persons across the world has to choose between seeking health care or eating. And we are living in a world where disinformation is undermining confidence in science and is therefore jeopardizing many lives, reducing inequalities and ensuring that scientific progress and health progress actually does reach the people where they actually live, regardless of where they live. We cannot protect health in our borders if we're not able to also protect them outside and beyond our borders, because viruses do not understand the concept of borders, nor flags or passports. Therefore, no country can save itself. Protecting others is the best way to protect ourselves. Our own selves. It's a question of justice, because it is obvious that neither you nor I wish to live in a world where 12 persons can own more wealth than the rest of the world. For millions of women, delivering their child is a question of fear rather than hope. Accepting something like this is assuming that the lives of millions of persons is worth less simply because of where they live. Political decisions taken by a few and blessed, unfortunately, by the silence of many others. In just a few months, the same country that cut $18 billion from global public health and ODA has spent more than $29 billion on war, the humanitarian consequences and geopolitical consequences of which will also be devastating. Common sense is what makes that us stand up before those who have decided that some should live and others should die based on their zip code. Bending common sense has become a form of rebellion, because there is a pandemic that nobody wishes to curb, and that is the pandemic of egoism, selfishness, and that is what is really affecting our societies, and that also can spread. To invest in the global response capacities to future health crises. The second pillar is to reform the financial architecture of global health. We need more resources, there's no doubt, but we also need new mechanisms to mobilize them. Global taxation. 3.4 billion persons live in countries that spend more money to pay interest on their debt than to finance health or education. Third pillar is to democratize governance of global health and make it more effective and efficient. The countries in the global south must have the role that they deserve in decision making, internationally speaking. We must never forget the best lesson from the pandemic. There is no national security possible in a world that has no health security. Anyone who understands this after an episode such as what we experienced in 2020 is either ignorant. Who has not understood is either ignorant or silly. Let's show that we have learned the lesson now that the WHO has declared the outbreak of Ebola in the DRC as a public health emergency of international concern today. Whenever a country acts responsibly, others follow suit. This is a sort of contagion of solidarity. The WHO, the World Health Organization, the European Unity bodies, and the other countries whose citizens were on board that vessel work together with loyalty and commitment to make the operation a success. And what I'm really trying to say is that whenever we respect international law, we all win. Either we fight together or we fall